Hello guys, in this video we are going to discuss about pediatric seizures, right? So there are many types of pediatric seizure: febrile seizure, generalized tonic-clonic seizures, juvenile myoclonic epilepsies, and many more, right? But we are going to discuss, of course, the most important part, and whatever important is asked in your question, right? I will mark them in red. Right, so coming and starting with febrile seizures. Febrile seizure, what does febrile seizure means? Seizures due to fever, right? That is called febrile seizure. Now, what is the general age? Now, fever causing seizures will generally not occur in you and me because we are adults, right? They generally occur in pediatric patients only. So, when which age do they happen? It is 6 months to 5 years. It is very important that you remember the duration or the timeline, 6 months to 5 years. And very important, do we see neurological deficit after febrile seizure? The answer is no. Extremely important. You cannot afford to forget it. No neurological deficits will be seen. Now, what are the types? There are two types of febrile seizures. First one is simple or typical, and the second one is complex or atypical. Right. What are simple or typical type of febrile seizure? When only single episode of GTCS has occurred, only single episode of GTCS has occurred, right? Single episode of GTCS has occurred. Second point, it lasts for less than 15 minutes only, right? If it lasts for less than 15 minutes and the seizure occurs within 24 hours, within 24 hours of fever onset, right? Occurs within 24 hours of fever onset. Now, what is complex or atypical seizures? What is complex or atypical seizure? Anything not meeting the criteria of simple seizure, right? For example, if there is more than one episode of GTCS, it will be complex seizure. For example, if it lasts for more than 15 minutes, it is complex or atypical seizure. For example, it occurs after 24 hours of fever onset, then it is complex or atypical seizure. So extremely easy. So let me write in this way. It will be more easy for you. More than equal to 2 episode of GTCS, right? Last for more than 15 minutes or after 24 hours. It occurs after 24 hours, right? Very easy. So this particular thing you have to remember, generally asked in question. What is the treatment of febrile seizure? It is, first is benzodiazepine IV. It is given IV, and paracetamol, of course, because it is febrile seizure. How to prevent it? Oral clobazam or diazepam, right? And it is not recommended routinely. So for giving prevention, there are indication. For giving prophylactically, you will not give it to every patient. You have to give it only when there is an indication of prophylaxis for oral clobazam or diazepam. What are the prophylaxis? If the febrile seizures are recurrent, right? For example, more than equal to 3 episodes in just 6 months duration, you have got more than equal to 3 episodes in that baby febrile seizure, you will give prophylaxis. If the first episode is at age less than 18 months, right? Or if there is family history, then you will give prophylactically. Now coming to other seizure types in pediatrics. Always remember, these indication and prevention is not important, but this criteria and duration and no neurological deficit is important about febrile seizures. Now other seizures in pediatrics. First of all, absence seizures, right? In absence seizure, it is very important, there is no post-ictal phenomenon. So what is actually no post-ictal phenomenon? Post-ictal phenomena are, for example, blackouts, vomiting, auras. So these are post-ictal phenomena. After seizure, people generally have these type of symptoms. They will be nauseating, vomiting, auras, weakness, right? There will have blurred vision, but these things don't occur in absence seizure. That seizure will come and go as smoothly as possible, right? Nothing will happen. It generally lasts for less than 30 seconds, important, right? And it generally occurs in school-going children. So what it is precipitated by? It is precipitated by hyperventilation. It is precipitated by hyperventilation. If you hyperventilate, then you will get febrile seizures. It is precipitated by hyperventilation. Okay. Then what is the EEG pattern? Extremely important. The EEG pattern is 3 Hz spike and wave. 3 Hz spike and wave. Right. So this is the EEG pattern, extremely important. I have covered it in a red box, although written in a green one, but it is extremely important. What is the treatment? Treatment is sodium valproate. Now coming to myoclonic seizures, it generally occurs after awakening. ठीक है, एकदम सुबह सुबह होगा, जनरली इन adolescent, the child will be an adolescent male most probably. Generally सुबह सुबह होगा, he will be packing up his school bag or drinking a coffee or drinking a milk, and suddenly he will throw the spoon out in a weird manner somewhere, right? So this is the particular feature of myoclonic seizures. Always look at the videos of these type of seizure. It is very interestingly given in YouTube. There is a channel only that is dedicated towards showing how these epilepsies look like. Go and see how these epilepsies look like. They are interesting also. You must see. Also called juvenile myoclonic epilepsy. If it comes in a repeated manner, then it is called Jan syndrome. Extremely important. You have to remember the name. What it is precipitated by? It is precipitated by lack of sleep. Right? Lack of sleep. Absence seizures are precipitated by hyperventilation, but this is precipitated by lack of sleep. What will be the EEG pattern? It will be 4 to 6 hertz spike and wave, right? 4 to 6 hertz spike and wave pattern. These patterns will be given in your examination in written format. Generally, they will not give you the EEG itself, but they will write these lines. The right 4 to 6 hertz spike and wave pattern is seen. Then this is the only way or the easiest way to diagnose if you remember these things. Right, for absence seizure it is 3 hertz spike and wave. For myoclonic seizure it is 4 to 6 hertz. What is the treatment? Again sodium valproate. Again sodium valproate. Now coming to West syndrome. West syndrome is a very interesting type of seizure, and again I'm telling you, see these videos in YouTube. Infantile spasms. Right, these are infantile spasms. Why? They occur generally in child less than 1 year. They occur in neck flexors. That's why it is called neck flexor spasm. Children generally have low IQ, right? And these are also called salam spells because the way people do salam is a thing of greeting someone, right? So the way salam is done, this is the same way these seizures will present in a child, right? So look at the videos only, then you will understand. What is the EEG pattern? Extremely important. Hips arrhythmia. Hips arrhythmia. What is hips arrhythmia? What is hips arrhythmia? Hips arrhythmia is high voltage spike in a chaotic background. High voltage spike in a chaotic background is hips arrhythmia, right? So here you can see this is a normal one and this is hips arrhythmia, right? See these patterns, these are so smooth and normal, and see this, totally chaotic, right? And in this chaos there are high spike and wave patterns, and we see these are high spike and wave patterns, these are high spike and waves in a chaotic background, right? So images may be given, the examiner may give you an image of hips arrhythmia and they may tell you to diagnose it based on that image also. If it is given, then the question is very easy, right? Because hips arrhythmia is very easy to diagnose. You can easily see it over here. So what is a poor prognosis? What is the prognosis of this particular disease? The prognosis is extremely poor, right? Very, very poor of West syndrome. Now we're coming to the treatment part, most important. The treatment is ACTH, surprisingly ACTH, right? ACTH, but it can also be vigabatrin, right? Vigabatrin if the West syndrome is associated with tuberous sclerosis. TS stands for tuberous sclerosis, right? And ACTH if normal, if not associated with, right? I'm not writing in normal, if not associated with any other thing. Now coming to Lennox-Gastaut syndrome. What is Lennox-Gastaut syndrome? Now from this it is not important, right? Not important, right? I'm writing over here just for the sake of completion. I'm given Lennox-Gastaut syndrome. It generally occurs in 2 to 12 years old child. The only thing important about it, even if it is asked, the only thing important is multiple seizure types. So if they describe you multiple seizure types, for example, they give you they tell you that EEG looks like that of 4 to 6 hertz, and also it has 3 hertz, and also it has other things, then always think of Lennox-Gastaut syndrome, right? In EEG, 1 to 2 hertz spike and wave pattern can be seen. 1 to 2 hertz spike and wave pattern can be seen. And what is the treatment again? Sodium valproate. The only important thing and the only PYQ about this particular topic is the treatment. Treatment has been asked. It is sodium valproate. First line treatment is sodium valproate. Coming to the next one, benign Rolandic centrotemporal region. Right, you can easily understand benign and centrotemporal. The seizure must be originating from the centrotemporal lobe. It is focal. EEG shows spikes from the central and the temporal part only, and it resolves by adolescence. Important part of this topic is treatment is carbamazepine. That's it. Next, Dravet syndrome. Dravet syndrome is a unique type of seizure. In first year, the seizure will be febrile seizure. In second year of life, it will be a febrile seizure and will have multiple seizure types. And then there will be developmental delay with refractory seizures. Right. The only important thing about this, it is due to de novo mutation of SCN1A gene. SCN1A gene. It is actually a alpha 1 subunit of sodium channel, right? Sodium channel, alpha 1 subunit of sodium channel, right? Even if it is asked, they will ask you this thing only, that what is the where is the mutation present. So we have completed it, guys. The only important things are febrile seizure, Absence seizure, myoclonic seizure, and West syndrome. Nothing else is important. Thank you.